I'm a chartered accountant from southern India, Chennai, and first moved out of Chennai when I got my first job, which was in 1986 in Calcutta. I joined ITC, worked with them for about 8 years, then moved to an agri-trading business, which is Continental Grain, Cargill now, for about two years. And then I joined the insurance sector way back in 1996. So I have been in insurance since 1996. Initially with Royal and Sun Alliance Insurance, and now with Apollo Munich. Health insurance is something which is an absolute necessity in this country. When we started on this journey, or at least when I started on this insurance journey way back in 2000, it was not understood. Health insurance, if you ask somebody, they would say, is it life insurance? But I think there's lots happened since then, and much of it has happened with the help of players like Apollo Munich. People have now become aware that there is a financing tool called health insurance. Are they all buying it yesterday or today? No. There's still a long way to go, and that's where the traction needs to take place. The big thing in 2017 or 2016 is that very clearly the market understands who is a serious health insurance player and who is not. The trend I see is that there is a lot of choice. People are able to pick and choose and also consult industry experts to actually find their choice. Health insurance industry in India, I must say, is a very, very competitive. It's still only about 25,000 crores, but I say only about 25,000 crores because I see the potential of it going to 250,000 crores, 10 times easily in the next few years, because there is a huge need and there will be a demand for it. At this point of time, if you look at health insurance industry statistics, unfortunately, it does not show a very encouraging sign. It's a loss-making industry. If you look at financials of different sets of players, you will find that there are players who understand the market. We would like to consider ourselves on the side of where people understand this business. What we will be doing is we will be trying to understand the actual needs of the various segments of the people across the geographies. We will cater to the individual requirements rather than go by what had been in the past in the earlier years, that one size fits all. Here is a policy and it suits everybody. But we like to see, what is the population, what is their requirement, how can we solve it? And then we look at products, features and price. I think the biggest change since 2007, since Apollo Munich came about, is that we very, very clearly demonstrated to the market that innovation has a very, very strong place. In the prior years, there was a system where if you claimed at the renewal time, you either did not get your renewal notice or you had a loading, which means your existing premium would have been loaded. That means you're penalized for claiming the previous year. So we questioned ourselves saying, this is a business. Health insurance is a business of paying claims. So when a person pays claims, why would you penalize the person when the renewal time comes? So we said, as a company policy from 2007, from the day we were born, we will not penalize the customer who's claimed. It doesn't matter because we're in the business of paying claims. So that was an innovation in the market. Till then, claims loading used to happen. Now it is regulatory. It's prohibited by regulation. Regulation says that you cannot load a person, and we had actually done it in 2007. Another example of innovation. In the earlier years, insurance policies, health insurance policies had a lifetime. That means it expired at the age of 65 or 70 or 75. After that, renewal was not possible. That was the state of affairs a few years ago. When we came in, we said, when does the person require the policy most? As he ages. How can we say that the policy will not be available at that point of time? So we challenged the status quo. And we brought in the concept of lifelong renewal. Once you are with Apollo Munich, you are there forever. We will never close the file. We call it as a lifelong renewal. So we introduced that as an innovation in 2007. Now it is the market norm. Regulator insists that every company selling health insurance has to have lifelong. So there are several things which we have brought about under the banner of innovation that we have done and we will continue to do, and I think that's the big change. And when players like us do it, I'm very happy when others copy it. Some people are said to me that your competitors have done exactly the same. I'm saying I'm very, very proud, because which means that they are applauding me and saying that we have done something right. We brought in Optima Restore, which is actually restoring the sum insured even if you have bust the limit. If somebody had a 5 lakh limit and unfortunately used it up in the first month itself, in the earlier system, for the balance of the 11 months, the person had no cover, exposed. Or if it is a floater policy, the rest of the family did not have any cover. So it's a big exposure. So we said, no, we have to solve the problem. So we said, you can restore the sum insured once free of cost automatically. So you buy a policy, if you have to use it in the first month, please use it, no problem. Don't be worried that the 11 months you're exposed, because we have got a restore facility which will be restored automatically. So these are just examples of the changes which Apollo Munich brought into the market. Every industry has to sustain itself, be it a government business or be it a charitable institution or be it a private sector. It has to have a self-financing mechanism. Otherwise, at some point of time, it will break down. Now, health insurance companies or insurance companies, general or life insurance companies, have been licensed by the regulator. It's either 100% owned by the government of India, or it is privately held by 2 or more shareholders, right? So the moment it is owned by a shareholder, at the end of the day, the shareholder also looks at a certain rate of return. Now, the regulator is in place today to make sure that whatever is in the market, products and prices, is fair to all. At the end of the day, if anybody does not win or anybody feels that they're not getting a fair share of what they want out of the equation will break. So in the insurance business also, unless there is profit, unless there is a return, more investments will not come in, be it from the government or be it from the private sector. Government will stop subsidizing after some point of time, because where will they get the money from? So there is a return aspiration for those who are investing capital, and that is applicable in all industries. It is applicable in insurance also. We have recognized right from the early days, and we continue to recognize, that the world we live in is changing every day. Issues which we had 10-15 years ago are very, very different from issues which we have today. For example, infectious disease, the dengue infection or the swine flu is much, much more prevalent and much more contagious today than it was 10-15 years ago. Lifestyle diseases such as diabetes, cancer, blood pressure, heart, are all things which are happening because the way we live today is very, very different from 10 years ago or 20 years ago. So Apollo Munich as a company is also recognizing this, keeping an eye in terms of what is happening around us, in terms of our lifestyles, and how that is impacting the people of India. The biggest differentiator, I would say, is customer service, the way we look at our customers, both at the time at the application form filling up stage to the time when they actually need our financing in the hospital. We ensure that everybody in this company, be it employed directly as a headcount or indirectly as an agent, understand that for us the most important person in this equation is the customer. Healthcare is a pretty wide subject in itself, and it's a bit complicated because it has got center as well as state involved. So it's not the easiest of industries to manage, and hence it is where it is. The one big thing which I believe should happen in India is that healthcare should be a fundamental right for every person. It's easier said than done. There is lots to change. There is a shortage of medical practitioners, there is a shortage of infrastructure, there is a shortage of funding. So there's lots to do in India on the healthcare front. I'm very glad that every year there is a mention of it in the finance minister's speech. In the budget there is allocation. I think Prime Minister Modi is very, very keen to make sure that there is healthcare for all. It's the right way of looking at things, but I think the real challenges will be having all of this implemented around the country, and Apollo Munich has a small part to play, and we'll be very, very happy to play that part.